Hello, welcome to Skills class. Today we're going to go over some medical things for nursing with kids. You may not have a nurse in your orphanage or school, but you are going to probably wear many hats. So it's good to know remedies for different things. And I will go over several things like, for instance, wounds, fevers, bites, keeping hydrated by drinking enough water, what to do if someone bumps their elbow, pink eye, sickle cell, and we'll do a little recap of germs and hand washing. So that's what we have on today. And I'm going to do a little prayer. Dear Heavenly Father, please bring people on quickly. And I pray that we will be able to learn and be able to take care of these children very well. And please help us to remember what we learned. We ask these things in your name, Jesus Christ. Amen. Okay. All right. So last week I was talking about wounds and germs, and I'm just going to go over that real quick one more time. Wounds have to be kept clean and dry. It's very important not to touch the wound, put your finger in the wound because our fingers have germs. And if you introduce germs into a wound, it only takes one touch. You can have an instant infection and don't want that. Then it gets red and hot and painful. You need antibiotics and all that. So you don't want the doctor's bill. Just don't touch the wound. Keep it clean and dry. I talked about Band-Aids, which maybe you can get a donor to send you some or pay for some Band-Aids. They come in all different sizes. They even have little round ones. This one is a larger one for a larger wound. And Band-Aids keep the wound clean and dry. So even if it's just a little cut, it's good to put a Band-Aid. It does speed healing. It does prevent infection. And it makes the child stop crying because if they're bleeding, they start crying. And then when you put the Band-Aid, they feel better. They know someone cared and they're okay now. So germs are our biggest enemy in general for preventing disease. We want to do hand washing. That is the number one way to prevent us from getting sick, whether it's a cold or measles or whatever it is. That hand washing really, really helps. Now, measles is by the breath, but like a lot of these germs are contacted by putting our hands in our mouth, our nose, our eyes, our ears, and that's how we get most colds and most illnesses. COVID is spread by droplet and it's airborne, so that wouldn't help as much, but COVID is spread also by things. So if I touch this mouse, right? And I had COVID and I had put my hands in my mouth and I touched this mouse. And then Juliet came and she used the mouse. And then she put her hands in her mouth. She could get COVID that way, right? So if she washed her hands after touching my mouse, she wouldn't get COVID if she put her hands in her mouth. So hand washing is the number one way to prevent infection. I posted a hand washing song in English. I don't know if that's of any help, but I posted one in English on the chat. It's really cute. It goes something like, we'll rinse our hands with water and take some soap as we oughta and rub our palms together. We know how to wash our hands and we'll rub the back of the right hand, rub the back of the left hand, crisscross our fingers together and back to the palms again. Then we'll rinse our hands up with water and rinse our hands up with water. Get all the soap off our clean hands the germs go down the drain. And there they go, going down the drain. So that is posted. So if you wanted to learn that song, it's on YouTube and it's posted. So those nasty little creatures that we can't see, we can only see them with a microscope. Those nasty little creatures, that's what gives us all those hospital bills. We don't want hospital bills. Yeah, very expensive, right? So hopefully a few more people will jump on. So that's our recap of last week. And hi Juliet, welcome. So we're gonna do okay. So if a child bites another child, now this happens all the time here. I don't know. I mean, maybe the kids in Africa are much more well behaved. But India, they might be much more well behaved. But here we have kids bite adults, we have kids bite each other. Now, if it doesn't break the skin, you can just wash the surface of the skin and you're done. But if it breaks the skin, you have a possibility of transmitting different germs, and you want to make sure you disinfect. So you're going to also wash the area very thoroughly with soap and water. If you have antibacterial soap, that's very good. You can disinfect wounds with things like peroxide. I don't know if you have that. Alcohol is maybe much more common, but it's not very good for wound healing. It slows wound healing and it burns like crazy when you pour it into a wound. So rubbing alcohol is not really the best thing, but you're better off with like iodine solution or peroxide. Those are the best things to pour into a wound. Or sterile saline is very good. Now, you may occasionally, somebody that you know or yourself may have a wound that is large. If you have a wound that is large, it's important to clean it in a very special way. If you don't have peroxide and you don't have, rubbing alcohol and you don't have iodine solution, what you can do is you can boil water, let it cool. And what you do is you pour it into the center of the wound and you clean from the center outward. And that way you get the germs out toward the skin, which is dirty. You want to keep the wound sterile. And in this way, you can prevent infection. I know we have a lot of people in hospitals with pus in their wound and green drainage and yellow drainage and brown drainage coming from the wound. And this is all because there's germs in the wound. You don't want that because if you have that, you need antibiotics, very expensive, sometimes given by intravenous through the vein. You don't want to go through that. So you're going to try and keep that wound clean and dry. So you're going to clean from the center outward and let the directional flow of the sterile water go outward from the center of the wound. You can dry with a gauze. This is actually like, I think, some kind of, I don't know, polyester or nylon or something, but there's most gauze is made of cotton. And if it's in a package, like a paper sealed envelope, that means it's sterile. We usually say sterile on it. That's what you need for a large wound that you're going to dry. So you'll put on gloves and you'll open it and you'll just pat it. If you pat a wound like this, it doesn't hurt and it doesn't damage the tissue that's trying to repair, which is very delicate. So you're going to just, and you're done. Let the rest air dry. Yeah, so that's about wounds. Occasionally a child may say, I bumped my knee or I bumped my head. Even worse, that's not good. All right, so this resource you may not have, but if you have, there's a cold compress filled with a special gel that holds cold. And you have to keep these in the refrigerator if you have a refrigerator in order to keep it cold. Or they have ones that are disposable. They are room temperature until you use them. They are made of plastic, and inside there's some kind of special powder. And you have to feel for there's like a little bubble inside. You pop that bubble, and then inside the bubble there's some kind of other chemical which mixes with the powder, and you just go to mix it, and it turns cold immediately. These are kind of expensive, but they're really important to have when someone gets really hurt, especially if it's a head injury. You put the compress on the pain. You can also use cool water on a rag, is better than nothing, and keep changing it. And you can also, it's cool water, you can flip it over and keep flipping it over, and the other side gets cool, you flip it over again. And the cold really helps because what it does is it prevents your cells from basically self-destructing. When a cell is damaged, it says, we're lost. Let's self-destruct. We'll make a new cell. Now, if this happens, your cell releases these little chemicals that dissolve the whole cell. This results in more pain, more swelling, more redness, more damage, longer healing, longer time to heal. So you'd rather save the cell and repair the cell. And that's what the cold does. It says to the cell, don't self-destruct. Please don't self-destruct. You can repair. It's going to be okay. So that cell will all of a sudden start taking, vitamins and minerals from the bloodstream, and it'll start rebuilding, and you have a shorter healing time, less pain, less redness, less swelling. It's really a good thing. So if you can do that, even a cold rag or cold water is fine, better than nothing. You really, really help. It also incidentally reduces bruising. You have someone hit on the face, you don't want a big black bruise, right? So if you put the cold there, it helps to prevent some of that bruising. All right, so that's very important. And or I'm going to move into illness called pink eye. That also has to do with our germs. I got a special germ here. You got to see him. Germs. Yes, this is a bacteria. He's made into a doll. Cute. Anyway, this is a very lovely, cute, and cuddly germ. But most germs are not lovely, cute, and wonderful like this one. They harm you. So if you get one of those in your eye, you're going to have a thick discharge. We call it discharge, stuff coming out of your eye. It's like pus or drainage, can also call it drainage. And it usually forms in the corner of your eye. It can also get all over your eyelashes. It can also glue your eyes shut when you wake up in the morning and you wake up and you're like, I can't open my eye, because you have a bacteria, and bacteria make poop. That's why you get all these colors of, pus and all this. So now you have a bacteria or a virus in your eye. It's causing this color drainage. Take note of the color. You need to know that color. You need to know if it's thick or watery. And these are the things you would tell the doctor if you went to a doctor. Now, pink eye can heal on its own, but it does take much longer if you don't have the drops from the doctor. If you have viral pink eye, you can have like a thin, like a watery discharge that's yellow or green. If you have a bacterial pink eye, it's very thick yellow or green usually. Can have other colors, of course, but the color is important. You tell your doctor, he knows what medicine to give you. The high sign of pink eye is pain. You would think that looks itchy. The eye is all red. The white of the eye is all red and bloodshot, right? You would think that looks itchy, but no, it's painful to have pink eye because your eye has been taken over by a virus or a bacteria. And if it's bacterial, it's real thick discharge, you're gonna need to go to the doctor and get your drops. If it's thin discharge, drops speed the healing significantly, but it can clear up on its own. But if it's thick discharge, you should go to the doctor to save your sight. Yes, you should go to the doctor to save your sight. I'm going to tell you one more thing about pink eye. You can have allergic pink eye, which is called allergic conjunctivitis. Pink eye is conjunctivitis. If you have allergic, it's from an allergy like dust in the air, mold, pollen in the air. Your eye gets very red. It hurts. You're rubbing it. You're itching it. And you're getting a clear, watery discharge. That's allergic conjunctivitis. That will go away on its own. Good thing for any kind of conjunctivitis is a cold compress will help. I know sometimes you can't go to the doctor. You don't have money. You can't get to a clinic or hospital. So you can have a cold compress, put it on your eye every so often. And it really gives a lot of soothing for the pain. It helps it heal a little bit. But basically, if you don't have the drops, you're in for the long haul. It's probably going to take a week or two, maybe even a month to go away. But if you have the thick discharge, go to the doctor. You have to go to the doctor because you don't want to lose your, eyesight. So, that's basically it for pink eye. I am going to move on to fever. Fever is also called by germs, although you can get fever from many things. The next thing we're talking about is sickle cell. You can get a fever from sickle cell anemia. But usually a fever is from like some kind of a viral or bacterial infection. And your body, it's a natural thing. Your body is trying to kill the virus or bacteria by heating your whole body up. And that is not good because the brain has to be kept within certain temperature range. So if the brain gets too hot, what happens is the proteins, the molecules that make up your brain you have a molecule of your brain, it starts to unfold. And your brain ceases to be a brain. It starts to be jelly. Not good. You can die. So if your fever goes above 40 degrees Celsius or 104 degrees Fahrenheit, you gotta get cool. You can do that by going to the hospital. They have like a cool blanket that's like electric and it cools the body. Or you can do it at home, but either way, you got to do it. You got to lower the body temperature. This is a little traumatic if you have to do it this way. Some people have to like go in a bath of ice, cool water to lower the temperature of the body. It's very, very important to do so to prevent coma or death. You can't have a fever that high. It's very detrimental.
Believe you like that, like quarter to 10.
Yeah. So cold packs on the head are very helpful. You don't want a molecular breakdown of the brain. Just keep in mind, normal body temperature in Fahrenheit would be 98.6, but females will vary throughout the month because of the menstrual cycle. And the temperature varies depending on what you're wearing, what the temperature is outside. But 104 degrees Fahrenheit, 40 degrees Celsius, danger. Okay, so take care of that. You can use paracetamol, which is Tylenol, or it's also called acetaminophen. That will lower the fever. Very important. If you have it, use it. And don't send your kid to school. Keep them away from other kids. If they have a fever, you don't want to catch it to other kids. So, sickle cell anemia. I understand that 4.5% of people in Kenya have sickle cell anemia. Even more have the trait. If you have sickle cell anemia, it basically means that you have a problem with building your hemoglobin correctly. And what happens is your cells collapse into, instead of being a disc-shaped cell, it turns into a moon, like a quarter moon shape. So you have a sickle-shaped cell. Now, these cells do not pass through the vessels cleanly. Like a round cell will go right through the tube, it'll be fine. But the sickle cells have points on both ends, and those points get in your tubular vessels called capillaries. And what happens is at your joints, they get stuck and they cause inflammation, swelling, pain. It can cause fever because your body thinks is there a bacteria? What's going on? The joints are swollen. Your body starts having a fever. And all these things can be treated and must be treated regularly because people with sickle cell have these problems all the time, especially if it gets like hot weather or very cold weather. What you want to do is warm packs for swollen joints. You can heat up a little water and put it in like what do you call it? A water bottle, a hot water bottle. Make sure that you test the temperature of the water with the inside of your wrist to make sure the person's not going to get burned, obviously. You're going to put that on the joint to relieve swelling that opens up the tubes of the capillaries, helps the cells to go through. It also gives comfort. You want to use what they call non-steroidal anti-inflammatory pain relievers, NSAIDs like naproxen, you know, trying to think of like, yeah, NSAIDs will relieve the symptoms of sickle cell. You can also have blueness, like you have swelling, right, in your elbow, right? Do you notice that the fingernails are turning blue or the lips are turning blue? That means you have an oxygen problem. The person is having trouble breathing, maybe. You should go to the ER if you have that, because if you're not getting enough oxygen to your hands, what's going to happen? Your hands could feasibly turn colors and you could lose your hand, right? So you want to go to the ER, you want to go to the emergency room with the ambulance and make sure that everything is, right before that person goes home. The blueness of the lips, of the fingernails, the toenails is a very bad sign, and you want to make sure that that person is okay. They can also get chest pain is common as well. Sickle cell is a serious illness. It can kill. People die younger than they should. So remember warm packs, NSAIDs, non-steroidal, anti-inflammatory pain relievers for sickle cell. I'm not sure of the names of the medicines in Kenya or India, but maybe next time I can come up with a list because I don't know. I don't know the brands you guys use in that country, in America. So yeah. And then we're almost done. Okay, we got about 3 minutes. Okay, very good. We only got two more things I want to cover. Your child is taking medicine for any illness at all. It's great to have a medicine box like this. You could see it says Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. The whole week is here. They also have it in a shape that looks like this. This is mine. It has letters for there's a W. I don't know if you could see that for the day of the week. That's for Wednesday. And this is great because you fill it at the beginning of the week. You don't have to open millions of covers of bottles, every day. You open them all once a week. You put the pills in, and then when the pills are gone, you took them. If the pills are still there, you forgot. Isn't that wonderful? So that is, and you know, the thermometer, I'm just gonna real quick. This is a very inexpensive thermometer. It's in a plastic sheath, and you can disinfect. It goes under the tongue. You can disinfect this with alcohol or any kind of hand sanitizer or disinfectant between use. But there's another way which is more expensive. They have these thermometer covers that you put it in between the tabs, and then you rip it here, and then you can peel it from the end. Not always the easiest thing to do. And now it has a plastic sheath over the thermometer so that you cannot possibly transmit your infection to the next person that uses the thermometer. You press this little button. You press this little button to turn it on. See? And you hold it down. I'm going to turn it off. You hold it down for like 3 seconds to change it from Fahrenheit to Celsius or Celsius to Fahrenheit. But when you're just turning it on and off, you just press it once, right? So you press it, turn it on, put it underneath the tongue until it beeps, which is about 1 minute. And then you grab it from here and you throw this out. And you know their temperature now. So that's fantastic for figuring out if you have a fever. Now we shall move on. The last thing is water. Very important. And I didn't mention that sickle cell, it's very important to keep hydrated. You must have plenty of water. So if the person is getting sick, give them lots of water to drink because water will bulk up the volume of the blood and the cells will flow through more easily if there's plenty of water in the blood vessels. So that is another really great thing, nice cool water to drink. And last thing is hydration. I have my liter bottle here. So water is very important for health of anybody, whether you're a healthy person or a sick person. You need to keep hydrated, especially if you're doing exercise, drink a little more. If it's a very hot weather, very humid, you're sweating, you need to drink more than usual. But in general, what you do to figure out how much water you should be drinking is, now you guys in Kenya use kilograms, so I'm going to do that first. Kilograms divided by 30 equals the number of liters that you need to drink per day. So kilograms divided by 30 equals liters. Okay, so, all right. And then if you use the American system for pounds, divide your pounds of your weight by 2, and you get the number of ounces. Ounces are very small, very small. Anyway, you get the number of ounces that you need to drink per day. And there are 8 ounces in a cup. So I didn't bring my measuring cup, but anyway, you can figure that out So it's your weight in pounds divided by 2 gives you the number of ounces. If you're in Kenya or India, use kilograms, divide by 30, you'll get the number of liters you should have per day. If you're sweating, if you're exercising, if it's a really hot day, you're going to drink more. You're going to need to drink more. And they say that, if you drink when you're just thirsty, especially elderly people, if you only drink when you're thirsty, you're going to be dehydrated. You're going to get sick. You're going to get headache, bellyache, nausea, weakness, maybe dizziness. You're going to get all these horrible feelings from dehydration because you didn't drink enough water. As people grow older and they're elderly, their thirst sensation decreases. They don't feel thirsty as much anymore. So the solution is don't wait to feel thirsty. Drink every so often. I drink about once every hour. And this works for me. If you're trying to get to the top of a mountain, they did a study of people climbing, I think it was Mount Kilimanjaro or something. And the people that drank every so often, whether they were thirsty or not, got to the top. The people who drank just when they were thirsty, they didn't make it to the top because your muscles need water. If the cell is full of water, it's firm and it's strong. If it's dehydrated, it's kind of like, "Ugh," it can't really work as well. It gets, clumped down. Not good. So your brain needs water, your muscles need water, everything in your body needs water. So drink up plenty of water, and that's it for today. Thank you so much, Juliet, for coming. And thank you so much, everyone, for watching the replay. I hope you got a lot out of this. We are done with medical nursing. Next week, we are going to work on teaching, how to teach kids so that they will remember. Very important topic, especially if you're opening a school. You may not be a certified teacher, but it's still good to know about teaching. So thank you so much and have a great day. Any questions?
Thank you very much.
Any questions?
I think I have one question
Okay.
on these sickle cell patients.
Uh-huh.
Is there any way they can be cured, like they can be treated completely, other than being on medication for the entire life?
Oh, they do have medications for sickle cell. Yeah. I honestly I don't know what they are, but yeah, there are medications for sickle cell that assist. And they sometimes need a blood transfusion. That's supposed to help too. But of course, it only works for a certain amount of time because blood cells have a certain lifespan. I think it's like 90 days or something before they get broken down and you make new. And they're
Sorry for
making new
interrupting.
ones that are, deformed. So what did you say?
My question was, is there a way it can be treated completely so that
Oh,
one is not just put on medication for the entire life?
oh, I see what you're saying. I'm not really an expert on sickle cell, but as far as I know, it's just something that a person has to live with and manage it properly. I don't think there's a cure at this time, but
Um,
the scientists are searching for different ways to help people. And, at this time, we have like warm packs, we have NSAID medications to help and drink water, blood transfusion. Those are really our big ones to help. Yeah.
mhm, mhm.
Yeah. So thank you so much. I'm going to stop the recording.